This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
We are so glad that you could join us for episode 2 of our series, Music in Health and Healing. In episode 1, we spent time understanding what music is and how it affects every part of the brain. We also discussed a meta-analysis study where the researchers found that 20 to 30 minutes was the golden amount of time needed to listen to music to help with pain. In this final episode of the series, we're going to focus on how music was used in other cultures, the effect that music has on mental health conditions, and even its influence on empathy.
And if it can decrease the amount of pain or anxiety, think about all the pharmacology we could save our patients from needing.
Yeah. I've already heard of it being used for these mental health conditions, such as depression and anxiety before, but can you elaborate?
So as I said, we've talked about depression and anxiety. There's actually been studies that have demonstrated in using it with patients with schizophrenia.
Oh, really?
Now, when we think about schizophrenia, we're thinking on the much more severe end of the mental illness continuum, but it has been shown to decrease the symptoms of the affective flattening, poor social interaction, and the general lack of interest. So it exhibits strong, pleasant feelings, overall improvement of quality health. It's not going to decrease the need for psychopharmacology.
Sure.
However, if we can decrease the amount of actual drug we have to give, or supplement it with, music therapy, that would be great.
Oh, yeah, absolutely. Is it practiced, or is it a common practice to use it on psych units? Is that happening that you're aware of?
Not that I'm aware of, and not that I can really find in the literature.
Okay, gotcha. And again, I guess because it's subjective, it would have to be a headphones thing anyway.
Yes.
Yeah. Interesting.
Yes. But we haven't talked about situational depression. We've talked about overall depression.
Right, let's.
But they have found in adults after surgery that, after major surgery, that when those patients select some music, it does improve their depressive scores. And this is both those going into surgery without any depression and those going into surgery with a major depressive disorder.
Wow. Isn't that amazing? Very interesting. Now, can it be used with people who have traumatic head injury?
Yes. And the literature is really growing on that. There is now music-based rehab for patients after traumatic brain injury. And it uses a couple of things. Uses both music as a way to calm the patient and also to increase executive function, increase neuroplasticity, as we talked about before, and also helps with emotional regulation. So those are just some things that listening to music can do. When you incorporate some very simple musical techniques, such as playing a hand drum, or shaking, a musical instrument, or beginning to play a recorder, that actually improves the feeling of accomplishments and also stimulates portions of the brain to start working together and making new connections, so that as the person is going through rehab, that the person can do more and more, because the neuroplasticity, you're actually making more and improved connections that are going over what has been damaged.
Wow.
And also, just that sense of regaining some function in life.
Sure.
Also, singing with our traumatic brain injury patients can help with speech acquisition.
There's that again.
So if the speech centers are damaged, it can help with that. And there's also some evidence that shows it even helps with white matter, increasing white matter, not just gray matter of the brain. So increasing the structural components of the brain. Going back to speech and singing, I think that some of the most famous videos of this is when the former House of Representative Gabby Giffords was shot in the head. There were multiple videos when she got to rehab of the speech therapist using singing to help her regain her speech back. There's a lot of data demonstrating music-based rehabilitation is really important with the patients with traumatic brain injury of all sorts, whether it's car accident, gunshot wound, stroke. I mean, all of those types of brain injuries, it really, really helps with.
So it's interesting. I had a friend several years ago who had a traumatic brain injury. He told the story of several times of how he really had no memory of the incident or after the incident, but kind of woke up in a group therapy where they were throwing a beach ball back and forth, and he kind of came to. And from that moment on, he could play music, and he never had prior. So I don't know if that would be indicative of a certain area of his brain being injured, but he played, and I'm not saying he was a virtuoso on any of these, but he played 3 or 4 different instruments. And he had never had any interest or ability prior to that. Mm-hmm. Is there anything you can share regarding that, or is that?
That has been reported in the literature a number of times. And the reverse, where somebody who was a musician got part of the brain damage that you wouldn't expect to affect the ability to play music, does. A couple, for more popular literature, Dr. Oliver Sacks, who is since deceased, he was the basis for Patch Adams and The Awakening.
Yes.
With Robin.
Brilliant.
So
movies.
He was a neurologist and a musician, and he actually published a book called Musicphilia. And there's a couple of, it was from his neurological practice, and there were a couple people that had been injured somehow, some way, and they developed musical abilities. One person had been struck by lightning.
Wow.
And yeah, it's a fascinating book to read. It's a quick book to read, but he really describes a lot of it because he worked with a lot of patients who had some sort of traumatic brain injury.
Can you repeat the name of that for our listeners? The book? The book?
Musicphilia.
Musicphilia.
Musciphilia.
Got it.
And it's Oliver Sacks, Sacks.
Okay. I'm writing it down myself. And if our listeners have not seen The Awakening or Patch Adams, those are great films. They're really, really well done. Okay, let's talk about cultures, different cultures. Are they using it for health and healing, or what can you tell us about music across our great planet here?
Music has been used for centuries.
Wow.
In healing rituals. Whether it's healing rituals for the individual or for the community. And it can be singing, chant, drum circles. People don't think of drum circles as music, but that's music. Some cultures still use music to induce a trance-like state to summons the spirits that they want to summons. Certain spirits get certain music. It has been a way to preserve culture and healing practices in cultures that have had to move, whether because of natural disasters or being forced to move. So there's really no cultures that I could find that didn't somehow incorporate music as a health and healing ritual. You can think about when you go to a Baptist church. There's a lot of gospel singing to bring that community health and healing. The first health and healing music was chant, and that's where Gregorian chant and our classical music started.
Right.
So there are lots of different cultures, different rhythmic dances. So you have to have some sort of music to do the rhythmic dances. So there's a lot of ways that music has been used. And what's hard about some of it when we discuss ancient, it's because it's like stories that have come down. We have cave paintings, and they actually think some cave paintings where it's just a person holding a bow, but there's no animal, is actually representation of the bow being used for music. You pluck the string.
Yeah.
Thus you get, all of our string instruments.
Right.
And the lyre and the lute and all of those. So it is in some ways hard to look at because, it is not written down.
Sure. And what's the expression about common language or music is the language? There's something on the tip of
music is the universal language.
I knew it was in there somewhere. You pulled it out of me. Or I pulled it out of you to help me. Yeah, the universal language, because it really is. It crosses all. You talk about cultures that speak different languages, and you can walk into France and they'll have a karaoke and singing American songs. Even if they don't necessarily understand the words, it's just it's the music, it's the feel, it's the association.
Yeah.
But also, I think being open to listen to music from different cultures is, you are an amateur musician, and I know I do this. I don't know if you do, but I'm really open to listening to what other people, including Gregorian chants, just to see and get a feel for that. And it's amazing how it evokes calmness or emotion just through the notes, right? With classical, you don't need lyrics.
Yes.
You don't need them.
And there's different styles. When we think of more Western music, our traditional classical music, but there's also all the Eastern music.
Oh, yes.
That uses totally different scales. And there are lots of people that watch old Bollywood movies.
Yeah.
And some of the newer ones are using more of the Western scales, but a lot of them are still use the Eastern scales,
right,
which evokes different expressions in people. And that also goes to preference, because if you've not grown up listening to that type of music and that style of music, it might seem very harsh to you.
Yes. Yeah. Right. Is there any evidence, or that you're aware of anyway, that opening your mind to different types of music can help with cognition, or just
Helps with cognition because it is still developing all those different with connections with the neuroplasticity. The other thing, though, it increases empathy, how you see the world, and how you view others,
right,
by listening to a wide variety of music. Music is an expression, as we talked about, anger, culture, personal beliefs, anger at a system. That's how it all evolves, and it's all related. You can trace all the different styles of music back and forth. But it really is that universal language that everybody knows, and most people like something of music.
Yes, that is true. An interesting project, maybe not related to health and healing. It is in a way, though, because I think that we have music in the background, or we watch a movie and they use music to evoke emotion, but we're really not paying attention to that much. But it really does have an effect. I had a project in college where I had to watch a movie blindfolded. And I had to physically go to a theater and watched an entire movie. A friend of mine went with me because I, couldn't find my way. I had to remain blindfolded throughout the whole thing. And afterwards she said, "How was it?" And I said, "That was an amazing soundtrack." And she said, "Oh, I didn't even notice the soundtrack," because my brain was focused on the music. It was an entirely different experience. And I felt every emotion that was going on in the movie, even in the scenes with no dialogue. Right. So we're not really aware.
That is correct. I know for me, one of the soundtracks that really evokes that I could not physically watch the movie, but listen to the soundtrack, was Steven Spielberg's Schindler's List.
Oh, it's beautiful.
John Williams and Itzhak Perlman use that emotional connection of music.
Yeah,
to help. But you're right too. Blindfold yourself instead of watching like an Indiana Jones movie. When the chase scenes are.
Yes.
When the love scene is. And that's all subtext.
Right.
And this isn't with health and healing, but marketing. There's research in marketing on how to get people to spend more money in grocery stores.
Right.
And how to target by your demographics what music you should be playing in your grocery store, in your, convenience store.
Right. Somebody understands the connection between the brain and music quite well.
Oh, yeah.
Yeah.
Yes.
Well, and the fascination with it being healing is just it's amazing to me that and I'm thrilled that it's being used in practice in a huge way. So one of the other things that I was thinking about was just that relationship again with the brain and music, in how you can be somewhere and hear a song from your past, and it literally can transport you right to another place.
Yes. And that's that memory. That's that real deep memory in the brain, in those older sections of the brain, and music evoking those feelings and those emotions, and triggering the cortex to really look at what the situation was back then.
So it would be smart for us as nurses with intervention, or any healthcare professional, really, again, to find out from a family member or the patient themselves what their favorite pieces of music are that calm them. I think it would probably also be smart of us to ask our loved ones what's their favorite music, because you never know, right? At some point. I mean, someone could ask me, my brother, what's my brother's favorite piece of music? And I'd be hard pressed, because his classical is not classical that I would listen to, just because it evokes completely different feelings in me. But I think that would be a smart thing to know.
It is. I actually have been involved with the university I work at. It has a children's hospital and their pediatric sedation service. When kids come in for whether it's shots, blood draws, or some other painful procedures, if they enjoy music, they will ask them what their favorite music is.
Wow.
And have the family bring it in to see if that will help decrease either the anxiety or the amount of sedation the patient actually needs.
Right.
And we're learning a lot about that whole block of pain perception. I'm blanking on the exact term, but people are starting to use virtual reality.
Right.
With music, and it's great.
Yeah. Yeah. Do you find, if I walked into a community hospital tomorrow, I highly doubt that I would see music being used, incorporated into the healing process. With the patient population there. Is it happening in research hospitals or educational hospitals that you're aware of?
In some places, yes. We actually did, one of our D&P students did it in one of our MICU, and they were instituting it in our MICU. I'll be honest, I think because of COVID, it's kind of dropped off because of the cleaning and
Right.
But if people bring it in, if they bring their own in, like if they know their first scheduled surgery or scheduled procedure, or they are allowed to use it.
Okay, that's good to know. I guess it wouldn't hurt to use it during a procedure. I guess, unless it was a sterile situation and they didn't want it in there. But anything, biopsy, colonoscopy, anything you could bring your music in for.
And
it has definitely effect on animals. So it makes, our brains are different, but not that different on a lot of levels. So we've seen cases where it calms them as well.
Yes, that is correct.
Wow.
That is correct.
This stuff really excites me. Again, having played music, it excites me as it does you, I know. And I think it would excite anyone from a caregiver perspective, correct?
Oh, yes. Yes, because it's something, when you think of it's something easy that a caregiver could do to help whomever. So whether they are sitting next to their loved one's bedside, bring in some way of listening to music softly if they have a single patient room, or make sure that the volume is not too high on earbuds or headphones. When they're home, if they're taking care of a dementia, one of their loved ones has one of the different dementias, playing the music that they love will maybe help calm them and also relax the caregiver, because the person isn't so anxious, and the caregiver can also take a deep breath.
Right. It's a win-win.
Yes.
Absolutely. And I can think of instances when I worked in ICU where we had patients where either the family were distant and hadn't arrived, or they didn't have family that we were aware of. And would it be, do you think, advantageous to experiment with different kinds of music in that case if you had no one to give you, you can't say what's their favorite music? Could you find...
It would depend upon on how stable.
Sure. Okay.
you could probably guess by the age.
Oh, that's a good point.
I mean, I hate to put ageism in here.
That's relevant. Absolutely. I wouldn't want the 90s played while I was trying to calm down. It's just not my era. Now I've dated myself. Everyone's going, oh, okay. Not that they thought I was 90s anyway, but yeah. Yeah. Well, yeah, that's a really good point. Yeah. On age, I was thinking maybe you could experiment with different types of what you perceive to be calming music.
Yeah,
but
you could do that too.
But the age, that's a really relevant piece to,
yeah,
it's reality.
There are apps that have calming music on them that we know, a certain beat, certain tone, certain pitches, certain melodies does calm almost everybody.
Right. Like our spa channel on Sirius XM or something like that. Yeah, that would be really interesting. This is very practical. I love this information, not just because there's so much research related to it. Again, it's a win-win on every level for everyone involved. Yes. I don't see a negative unless there was actually something played that caused, but if you notice the heart rate going up and them getting more anxious, then you just stop it. So I see no negatives related to this. Obviously, there's been a lot of research, and it's been around for potentially 35,000 years that people have been wanting to make and share those sounds. That it would be really helpful from a nursing perspective to pay attention to that. Add that as part of your care plan to find out what their music is and encourage them to listen to that.
Yeah. It's simple. It's easy.
It's free.
Yes.
In most cases.
And if it can decrease the amount of pain or anxiety, think about all the pharmacology we could save our patients from needing.
Yeah. Yeah. And I think you've mentioned this earlier. It takes about 25 minutes to 30 minutes for it to have a full effect from a pain perspective specifically.
Yes.
But you don't have to listen all day. You don't have to listen 24 hours a day. Maybe an hour here, take it off, rest, and apply it at another time. So that's really helpful. Well, I'm fascinated. I think I've said I'm fascinated several times throughout this podcast. It's turned out to be my favorite word through all of this, but I think it's really helpful. It's encouraging and it's applicable. It's something that we can all do now and take into consideration. I know it's easy. I've certainly fallen into this where I think, I just don't have time. I've got a million things going on. But when you think about it, the benefits and the win-win, and really it's just an inquiry and potentially someone bringing the music in for the patient. So I love how it applies to dementia and Alzheimer's. I'm sure it applies in long-term care facilities, whether they're suffering from degenerative disease or not. So I think this is absolutely fantastic information. Is there anything you'd like to add before we wrap up our wonderful podcast on this great topic?
And I think we have to remember for ourselves too.
Ah, yes. Nice.
We toss around the word self-care all the time.
We do.
But when we think about it, even for ourselves as caregivers, listening to music that we like can be calming to us. Taking that time just to, even if it's just in the background.
Right. Yeah. That's
just
great.
Taking that time for us to listen to what we like, we can get all these benefits too.
That's a great thing to add. Even if, and I know it's not we're not trying to control pain necessarily, or maybe sometimes depending on the individual, the circumstances, but even with you, when you have your break, I think sometimes we have a tendency to go to this while we have a break, and with that sense of urgency to keep up and not miss anything. And I think that can actually raise our anxiety level to a certain degree, where if we took that 15 minutes and put our earbuds in and just, closed our eyes and chilled for those 15 minutes, it's amazing how refreshed you can feel after that. So I'm really glad you brought that up. That's great. Applicable for ourselves as well. So again, this is a fabulous topic. It's a fascinating topic, apparently, according to me.
Yes.
And we're really thrilled that you shared your expertise with us today. This was extremely informative. Yeah.
Thank you.
Eye-opening. So I know our listeners probably gained a great deal from this today, too. So I thank you, genuinely, Dr. Carno, for spending this time with us. We really, really appreciate it.
Thank you. Anytime.
And we thank you for listening today. We encourage you to check out elitelearning.com for other courses that we have available as you work through your career and advance your career. And hopefully you'll find a way. There's a lot more that you can learn on elitelearning.com. Thank you again. This is Leanna McGuire for Elite Learning by Colibri Healthcare.
This podcast featured content from an accredited CE activity provided by Colibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.